One of the other questions that we saw a fair amount of in our registration was talking about scalp care. And you mentioned itchy skin, of course, being a common effect, and we know that can happen on the scalp too. And so if we're talking about itchy scalp, minimizing hair loss if possible, what kind of things would you recommend to your patients?
And so there's definitely some strategies to try and minimize that. But when you talk about itchy scalp, I would break it up into itchy scalp with or without hair. But the baseline for both of them is actually, I would recommend using an anti-dandruff shampoo. So a shampoo with either selenium sulfide, ketoconazole, or zinc pyrethine. These are all common anti-dandruff treatments, and use those about twice a week and massage them into the scalp and let them sit for 2 to 5 minutes. And really think about it as a treatment for your scalp, because these anti-dandruff treatments are very anti-inflammatory, so they can be soothing. I wouldn't do it more than twice a week because they can then get a little drying to the scalp, which is the opposite of what we want to do. If you still have your hair and you're itchy and red underneath, then you may require a prescription of an anti-inflammatory lotion. So that would be a liquid that you can massage into the hair quite easily. And those are generally topical steroid lotions that can be used. And I generally use them every night until the itchiness or dryness goes away, or a minimum of 2 weeks. And then I start slowly decreasing from every day to every other day for a couple weeks, from every other day to 2 times a week, from 2 times a week maybe down to once a week, and even trying to stop, all while continuing the anti-dandruff shampoo. And I equate any type of inflammation in the skin to basically like a fire. So if you douse out the fire and you don't keep on dousing it out, there's still ambers that are burning. And if you stop treating it, then it can light back up. So you really want to kind of do a prolonged taper off of an anti-inflammatory treatment. Now, if you're talking about a scalp that does not have any hair that's itchy, again, I would still recommend the anti-dandruff shampoo, but then you could actually use your moisturizer for your body, so a good cream or balm on the scalp.